Hello friends, today we are going to talk about the equipment purchase and management, which is the second chapter of your biomedical engineering and medical equipments. So as you know, equipment is a very important part in the hospitals, and it comprises of almost like 40% of the budget. Henceforth, there are various aspects when we consider equipment. It right starts from the selection of the equipment. How do you plan, like how much equipment has to be purchased, what is the criteria of purchasing, what is the procedure to purchase an equipment, what is the budgeting that has to be taken place. Then once the purchasing of the equipment has been done, what are the other aspects which is important while doing the maintenance of an equipment, and as well as it's the long time or the life cycle of an equipment. So these factors play a very important role. Now the first part, which is the equipment purchase. So before purchasing, as you all know, selection of the equipment is very important. So how do you select an equipment? It has to be done by means of doing a survey, which is important, so that you should know like which all equipments are important from the hospital point of view. And like I said, the hospital budget almost comprises of 40% of because of the equipments. Henceforth, lot of importance has to be given. It has to be a well thought of action where an entire team is being taken into consideration, which may comprise of the hospital administrator, the biomedical engineer, the epidemiologist, the financial experts, so that you should actually know like what equipment you are going to purchase and how much benefit you are going to take from the purchasing of the equipment, how much services you are able to give to the patient, and how much cost benefit analysis can be taken out by means of purchasing the equipment. So as far as the hospital equipment is concerned, there are four type of equipments that can be taken into consideration. The first one is the physical plant. For example, like a laundry linen plant, where you have to set up a full range of equipments in order to do the needful work. Similarly, there are other aspects of equipment which might comprise of the hospital furniture and appliances. Similarly, there are general purpose furnitures, appliances, as well as there is a category which is known as the therapeutic and the diagnostic equipment. Now when you come to the purchasing of the equipment, you should know the stages. First, if you are procuring it from India or outside India. If it is outside India, then import export, you should know about the import export regulations for purchasing an equipment. And usually, the when you take out the costing of any of the equipment, it does not only carry the cost of the equipment, but also there is a whole range of other costs that is also been involved. To bring into your notice here, we must say the cost of an equipment is equal to the fixed cost and the variable cost. The fixed cost is basically the cost of the equipment in general, and the variable cost may comprise of a number of other costs. For example, you can see over here the insurance of the equipment, and in order to procure it from outside India or from other foreign countries, then the freight charges. Okay, similarly, there is custom clearance, which might cost additional 1 to 2% of the value of the equipment. And all these things should be taken into consideration right at the time of negotiation. Before apart from this, there are also like most of the suppliers would be willing to absorb the additional cost. So when you are taking the quotation from the people who are going to supply you the equipment, so you can negotiate over there regarding all these things. Similarly, after you buy the equipment, there is an important consideration that has to be given in terms of after sales service. So in terms of annual maintenance contract, what has to be the cost of the annual maintenance contract. Similarly, the usually accepted norms for the services charge is 1 to 2% of the cost of the equipment for the first year, and then additionally 10 to 15% additional cost is being added as the machine or the equipment goes older. So these things are very important, and has to be taken into consideration before purchasing any equipment. Similarly, then you require a good teamwork in order to know like what will be the site of putting up the equipment and the preparation that needs to be done in advance. Therefore here it require a team of engineers which might comprise of the architect, the civil engineer, the electrical engineer, the AC, because the again the equipment, for example, like ultrasound and other those machines, it requires a full-fledged AC backup. Or for example, take the case of operation theater, again it requires AC installation. So it is not only the cost of the operating table, but also the support equipment that is being required in order to for that equipment to fully function. Similarly, you should also take into consideration the power supply, which, because you should know like what is the power backup, whether you are going to use an UPS or there is a whole set of generator, or the other set of equipments is required for the uninterrupted power supply. Then when you take into consideration, you should also know like the economics part, how much money you are going to spend from your own pocket, how much you are going to take loan, what sort of a service. For example, like suppose equipment is might be costing 3 to 4 crores, but what I am if I'm taking a loan from the bank, like how much I'm going to utilize that machine, whether I'm going to utilize it fully or partially or half or whatsoever. Because then from the patients, from the the services it is giving to the patient, and the money that we are going to earn, so whether we are going to the EMI of the machine can be paid back to the bank, as well as the costing or the maintenance cost or sustainability of the machine is feasible or not, all these things has to be taken into consideration. Similarly, if it can maybe wiser to purchase more expensive equipment which can be operated with much cheaper consumables which is available locally. So it is a whole range of things that has to be taken into consideration, or it has to be kept in your mind while purchasing a whole full-fledged biomedical equipments. Similarly, you should also have a list of all the suppliers, the procedure, the amount of negotiation, and the benefit the company is going to give you, what will be the after sales service, what money has to be given to the service centers. So you it is not just buying the equipment, but also maintaining the equipments. From here we come to this maintenance part. Once you have taken into consideration, so maintenance of the equipment is very very important aspect, because people, when you talk about biomedical equipments, they always think of in terms of purchasing, but apart from purchasing, maintenance is a very very important part. And as you know, like all the healthcare equipment including the hospital equipment are now based on sophisticated and high cost technologies. What technology you are using today might be old tomorrow. Okay, so henceforth it is very very important like how you are going to maintain it, what additional things you have to keep into mind so that the machine can perform optimally. So you have to see the existing situation, and you have to make arrangements for the maintenance of the equipment. You have to make an outline of the plan of the biomedical engineering operations. How many engineers do you require, and how much what about the calibration part, what about the annual maintenance thing, what about like the servicing of the equipment, whether it will be after 3 months, every 3 months, after 6 months, every 12 months. So it is very very important. Similarly, WHO has drawn the action plan on the, so clear cut guidelines have been given by WHO as far as the maintenance as well as management and the repair of the healthcare equipment is concerned. And similarly, you have to see like what all factors that are changing from time to time, and whether the machine is good enough so that it can it can be devoid of any negligencies or any parameters which can be harmful. So that also has to be taken into consideration. Similarly, what is the existing situation and the arrangements for the maintenance that has been done. For example, like when you are using a machine, how much it is integrated with your HIS, what will be the flow of information, what will be the various standard operational procedures that has to be taken into practice. and then how the data is being collected, how it is being analyzed from the machine, and how it is being used for the proper maintenance of the hospital records. What about the training of the staff which is going to operate that machines, whether they know how to use it optimally, whether they know how to take care of the things, how to maintain it, whether they will not do anything which can harm the machine. So these things are of immense importance. Similarly, there also has to be a strengthening mechanism for the exchange of the information expertise, both at the country level, both at the sub regional level and the inter-regional level, as far as the hospital equipment is concerned. Similarly, as from time to time the medical science is being getting advanced, and the physicians and the other medical staff should keep themselves updated with the latest technology and with the latest amendments in the fields of the biomedical equipments. Similarly, the other aspects is, suppose you are working in a government setup, you should know what are the various climate, location, size of the states, what type of facility, whether we are going to use it. So a whole range of variants or factors are important while buying any of the equipments. Similarly, we should also keep into practice what all procurement measures has to be taken that into consideration while you are purchasing for a government machine, or you are buying it from a private hospital. And then it should not be scarce, the resources should not be scarce, and it should be adequate, and there should be proper optimization or the utilization of the machine. Then what is the requirement of the equipment? Like I said, what is the workload capacity? It is very very important, like whether you are going to buy a machine and how much amount of benefit it is going to the hospital. What about the workload? And the need of these equipment would be directly related to the load of the inpatient, outpatient, and those attending the emergency services. So it is of immense importance to take into consideration, and it is directly related with your budget planning. The budget planning, basically the budget of any machine or the cost of any machine will be based on four things. Number one is the price of the machine, the logistics which is being seen, as well as utilization of the machine, and the quality of the machine. And in this slide you can see what are the various factors which are affecting the logistic. You can also see what are the various factors which can utilize the which also affects the utilization and the quality. So all these things has to be taken into account, not only for the equipment but for its maintenance as well as its sustainability in a longer run. Then what about the preventive maintenance? Like I said, you prevent the machine from getting decayed or from getting distorted. So that's why you would keep the things calibrated so that it gives you accurate information. It works well, it is able to the validity and the reliability of the machine is good, and it should be able to serve the purpose for which it is bought. So from here, it is important, like the preventive maintenance should be taken into account, and there should be a guarantee warranty period. And like you can see over here, the spares are obtained for 5 years, and the machine is also under service contract for at least 5 years by any of the vendors who is supplying the machine. And then there should be also an arrangement for the alternate voltage stabilizers, and in high priority areas like the operation theater, radiology, medicine, and the radiotherapy, the stabilization is of immense importance, otherwise it can damage the machine fully. And similarly, there is also a provision for the automatic switchover for the emergency should be provided, because there has to be an uninterrupted power supply in these areas, since these are critical areas for the sustenance or the maintenance of the patient. Then you have to prepare a master maintenance plan. You have to maintain you have to make a maintenance plan which is within the institution, which is outside the institution, outside the state, but within the country and outside the country. So the whole range of things has to be taken into consideration, and the biomedical engineer is the one who is taking account of all these things and making an appropriate plan for the same. Similarly, you should also make a short term plan in terms of recruitment of the skilled manpower who is going to handle the machine. And there is also establishment of a bank of spare parts and the crucial components, because the wear and tear of the machine can take place from time to time, and you should take into consideration, like whenever such a thing happens, you should able to replace it so that the machine do not get affected in the long run and the cost can be minimized. So from here we will take, like, there's a short term plan, there's a long term plan. As far as the short term plan is concerned, either the training of the manpower is important. As far the long term plan is concerned, you are developing a maintenance organization in form of a central cell, and then it is communicating from the other cells from where it is getting the information. And from time to time you are keeping an updated record of the purchase, procurement and the maintenance of the equipment. Similarly, you are also keeping a record of all the training sessions which is related with the maintenance of the machine. Then then you have to think of in terms of long term plan, the repair of the equipment, like which all companies or the enterprises you have in your portfolio, so that you can bring them as far as the maintenance of the machine is concerned. Because usually, in as an example, you will see in a lot of government hospitals, since the money is not going from the pocket of the owner itself, and since the government is responsible for it, so there is a wastage, there is a lot of wastage of money in terms of procuring the equipment, because the equipment has been procured sometimes in order to get commission, or as a result of which malpractices has been involved. But and then even after buying the machine is not properly utilized, which ultimately brings in the wastage of the resources. So these things are of immense importance when you think in terms of a government hospital, a private hospital, a semi-private, or a trust-run hospital, or a society-run hospital. Then as far as the repair is concerned, you have a in-house repair facility where you have got biomedical engineers which can do the needful done whenever a requirement of such a thing on an urgent notice is there. So then, as far as the repair procedure is concerned, the repair, there should be a central maintenance workshop and should have four levels of engineering staff. They can be divided into four parts, that is the highly skilled engineer, the skilled engineer, the semi skilled engineer and the ordinary engineer. So depending on this, the workshop can be maintained from time to time. And then you should keep a history sheet of the equipment. The health and the medical care equipment are both sophisticated and expensive, as I have already told you. And then there are a number of equipment that have already become obsolete, uneconomical, hazardous, so you should also keep a list of same. And similarly, there should be adequate records and documentation needs to be done from time to time, depending on the requirement or the upgradation of the machine. Similarly, you should also make another set of list where you should know, like, what are machine is being required, what are equipments is being required, what are the electronic calibrations has to be done in order to support those machine, what about the carpentry and the glass work which is being required in order to fix the machine, and what about the air conditioning and the refrigeration work that also needs to be done for the maintenance or the procurement of the machine. Similarly, as far as the history sheet of the equipment is concerned, like I told you, in the history sheet it will comprise of the identification of the data of the equipment. It will take, what is the make of the machine, which company, whether it's a Philips machine or a G machine or what is the model number, what is the date of purchase, what is the identification of the source from where it is being bought, what is the details and the reputation of the supply, the availability of the spare parts, whether the spare parts are easy to get or where are they manufactured, how much it is easy to be procured, which all vendor is giving you the services, what is the purchase cost, and the details of the breakdown and the downtime of the equipment. Then similarly, what are the repairs that is being already being undertaken over a period of time, what is the expenditure that has been incurred on the repairs, and if it is imported, then what are the further details of the same. For example, the custom clearance, the equipment brochure, the ISI mark, and the nature of the building material. So there's a whole range of information which is there in terms of history sheet of the equipment is being concerned. Then in terms of a blockchain, the logbook of the maintenance and the repair. You should know, like, the maintenance book should have all the records in terms of what is the warranty period, which all machine needs the servicing from time to time. So you should have a time frame, and always the reminder has to be there, like when urgently the machine needs to be gone for repair or for maintenance. Similarly, what is the expenditure which is being incurred on the annual service contract, what is the expenditure on the maintenance and the repair, what are the details of the preventive maintenance, and whether it is in working condition or not. Then you will also have a performance record of the equipment in terms of the period since the machine is being working, the level of utilizations in terms of in finance, as well as the output. So a cost benefit analysis has to be done, the periods when the machine was not working, what are the exact reasons for it for not working, and then if they are beyond repairs, then a certificate from the engineering unit should be recorded that the machine is of no use and has to be discarded and or has to be sold, okay, to scrap. Similarly, there is a condemnation or the disposal. There is a way of for the condemnation or the disposal. So at a given point of time, when one finds a large number of unserviceable equipment is there, they are lying in various sections, and there are departments of the hospitals which are being involved. So you need to prepare a full-fledged list. And because such an equipment, not only from the point of functioning, but also they occupy a lot of space in the respective departments, and they invite criticism, and they can also pose problems during audits if you are need to take an NABS certificate or a JCI certificate. Similarly, the condemnation process should be laid down and should be strictly followed. The procedure may be different for the routine items as well as it is different for the costly items, which is that means which is costing more than 2 lakhs of rupees, all the machine which is costing more than 2 lakhs of rupees. So the disposal has to be done either in terms of auction, because usually in auction normally 10% of the book price is kept as a reserve, and then followed by the auction is being done. Similarly, you can also ask for sealed tenders before deciding the minimum bid and declaring the minimum price. Or you can do an auction in terms of where the wide publicity is being given in terms of press or handbills or various kawadiwalas or scrap dealers, that is the scrap dealers, or to the sister institution which are interested in buying the equipment. And for this, a committee can be constituted which is basically keeping a record of all the equipments, and then it is doing an auction, okay. And then when the money for the auctioned equipment needs to be given, how much has to be given in the starting, and how much time the other person or the company is going to get in order to buy the further machines. So these factors become very very important as far as the disposal of the equipment is concerned. So similarly, and for example, when you are basing to dispose of the exceptional items, for example a cobalt machine in your labs, where it is basically a unit which is only utilized in hospitals, for example the radiations and all, okay. And similarly, for an extra developer and the fixer, the earnest machine should be obtained from the contractor before its disposal. So these things are very important. Similarly, in case of incineration, which is a high temperature dry oxidation procedure that reduces organic and the combustible waste, so it has to be disposed by a landfill site. So see, these things become very important, like what is the type of the machine, how much health hazard it can bring into practice, and what amount of money a person or the organization is getting in lieu of selling that machine or destroying it or whatsoever. What is Similarly, you have to take into consideration that you have to minimize the loss and the pilferage. The pilferage is basically it is basically in terms of like it is getting leakaged, and there's a leakage of the material. So there's a lot of wastage is there. So intense vigilance is being required in such a case, because in order to minimize the theft, because it is usually also seen that the equipments do get robbed, or there's a theft, or that's why it is being considered under pilferage. That's why you need to keep a maintenance of all the records, how many machines are there, and whether every time it is the same, the number is the same or not. And similarly, that's why it requires the effectiveness of a good materials management department, which is keeping a record of all these things. And then as far as the various methods in terms of evaluating the effectiveness of the materials management department is concerned, you need to think from a perspective of the supplier performance review and from the overall review for the management audit. So both has to be kept in tandem in order to see whether the appropriate functions are being done. For example, whether there is a timely availability of the material, what is the quality of the material that you are receiving, what are the number of occasions when the stockouts have already occurred. Similarly, the team audits or the management audits have to be done from time to time. And then last but not the least, one of the important factors is what is the cost of the material per patient per day, which is also known as MCPPD. So when you do a calculation, you should know, like that what is the material cost that you are going to spend on per patient on a particular day. So it is the ratio of the materials cost to the hospital total hospital cost, and this is going to give the cost, like how much money you need to charge from your clients so that you are able to sustain the entire thing. So MCPPD is one of the most objective methods of evaluating the effectiveness of the materials. And then the high is the MCPPD ratio, the better is the scope for a better materials management. And henceforth, if you are doing it and it is on a higher side, then the maintenance or the things is always in your control. So with this, we have come to the final slide. And thank you, like you have able to understood the concepts regarding the purchase, the maintenance, which is an important concepts. In the next class, we will be dealing more about in terms of the management of the biomedical equipments. And the website is being given below, and in case you need to have various queries, you can log on to our website, or you can also write to us through mail. Thank you so much for attending this session. Bye.